Hello and welcome to the Health Center channel. My name is Kezia and today I'm talking about antibiotics. Now, antibiotics is such a broad topic, so I'm only going to talk about what antibiotics are today, the type of antibiotics available, and what you need to consider when you are being given antibiotics. Then we end our discussion with the side effects of antibiotics. So please stay with me till the end. So, what are antibiotics? It generally means against bacteria. So, these are medication prepared to fight bacterial infection or avoid or prevent bacterial infection. Generally, what antibiotics do in your body is that when they get into your system, they kill the bacteria or they interfere with the bacterial activity, such as their cell wall formation, their protein synthesis, or their DNA replication. So they will do anything to stop the bacteria from multiplying. Now, there are different types of antibiotics which are used by doctors and clinicians. I'll talk about a few of them, about six different types today. We have the penicillins, and examples are the amoxicillin, the ampicillin, flucloxacillin, or co-amoxiclav. These are used to treat a wide range of infections. It could be chest infection, skin infections, or urinary tract infection. Normally, when I talk about penicillin, I want to go straight to macrolides because macrolides are also used to treat chest and lung infections, right? However, if there are individuals who are allergic to penicillins, or if you have penicillin resistant strain of bacterial, then you'll be given the macrolides. Examples of the macrolides are the erythromycin, azithromycin, or clarithromycin. So that explains why you probably got amoxicillin for your chest infection, but your friend or your family member got azithromycin or erythromycin. This person could have be allergic to penicillin. That is why. Now, another type of antibiotics are the cephalosporins. Example is cephalexin. They are also used to treat wide range of bacterial infections. However, some of them are very effective for serious infections such as sepsis or meningitis. We also have the aminoglycosides. Examples are gentamicin or tobramycin. Now, these antibiotics are really powerful. They are normally used in the hospital setting to treat serious bacterial infections like sepsis or even MRSAs. Now, they tend to give serious side effects. So, they are either given as injection, like intramuscular injections or intravenous injections. This is to try to reduce the amount of or the seriousness of side effects they might produce. Another form of antibiotics are the tetracyclines. Tetracyclines, examples we've got is the tetracycline itself and then doxycycline. These are usually used in treating skin conditions like acne or another skin condition called rosacea. The last type of antibiotics I'm going to talk about is the fluoroquinolones. Examples are the ciprofloxacin. Before, they were routinely used in treating respiratory tract infections and urinary tract infections. But these type of antibiotics are broad spectrum. So they end up giving us lots and lots of side effects. So these days, clinicians do not use it routinely for UTIs and chest infections. So these are the types, but there are other forms, other antibiotics available, like chloramphenicol for eye and ear infections, fusidic acid for skin infections, nitrofurantoin or trimethoprim for urinary tract infections. So, if you are giving antibiotics, what should you do? This is very, very important. If you are on antibiotics, you want to take the antibiotics just the right dose, the right amount, until you have been told not to take it anymore. Now, if you live in an area where you can have access to antibiotics without prescription, this is the caution. Do not buy antibiotics unless you are very sure you have a bacterial infection. The reason being that there are some infections which are just viral, like the common cold, some chest infections or cough. And if you take antibiotics for this, what you are doing, you are literally doing is you are introducing this medication into your body to go and fight the good bacterial colony in your body. So it is not effective, and in the end, you will have developed bacterial resistance, antibiotic resistance. So please be sure you have bacterial infection before you take antibiotics. Now, do not take more than you have been told to take. Do not keep antibiotics for the next infection you are going to get. Also, you should never ever lend your antibiotics to your friends or your family members. And you should not borrow antibiotics from other people. If you are on antibiotics, moderate form of alcohol intake would normally cause no problem. However, if you are taking antibiotics such as metronidazole or tinidazole, do not take alcohol because it will produce serious side effects. Antibiotics such as doxycycline, you do not want to take alcohol because it will affect the effectiveness of the medication. Ladies, listen up. If you are on antibiotics, generally most antibiotics will not affect your contraceptive method, whatever you are using. But if you are taking antibiotics like rifampicin or rifabutin, then this medication are known to affect hormonal contraceptives. So some contraceptives do not contain hormone, they are not hormonal based. And so rifampicin or rifabutin will not affect it. However, if you are taking the combined hormonal pill or you are taking hormonal patches or hormonal rings, vaginal rings, or even the IUDs, which contain hormones, then speak to your doctor first. You might want to switch to a different form of contraceptives, or during the time that you are taking the rifampicin or rifabutin, do take backup methods like the use of condom or diaphragm. You want to take it all throughout the period of antibiotic therapy and up to 28 days after you have completed your antibiotic therapy. Also, antibiotics may not work well with other herbal preparations. So if you're on anything like that, speak to your doctor. Let them know what you are taking before that. Now, if you are on a different form of antibiotics, let's say you had chest infection and you went for treatment, bacteria antibiotic for that, and then during the course you realize, oh, you've developed urinary tract infection, so you are now going to the doctor for another form of treatment. Please tell your doctor about the first antibiotic you've got so that they know how many doses to give you, which antibiotics to give you. Okay, so let's talk about the side effects of antibiotics. Most side effects of antibiotics are very minimal and you would not need to see the doctor. So about 10% of the side effects people experience from antibiotics are stomach problems, bloating, indigestion, nausea, vomiting, constipation, or diarrhea. These ones will normally clear off once you complete your antibiotic therapy. However, There are serious ones that you would want to talk to your doctor about it. If you experience allergic reaction to your antibiotics, such as itchy skin rash, you want to talk to your doctor. You might be given antihistamines to clear that. Allergic reactions will also produce signs like wheezing, cough, or sneezing, or even the tightness of your throat, so that you find it very, very difficult to breathe. Straight away talk to your doctor or call 999 or 111 for advice. There are some form of side effects that comes directly with certain types of antibiotics. If you are taking tetracyclines, which I said earlier that they are normally used for skin infections, some side effects is sensitivity to light. So whilst you are taking the tetracyclines, do not be exposed to light for longer periods. Now, antibiotics like the fluoroquinolones, examples were the ciprofloxacin that we talked about, usually produce serious side effects like severe muscle pain and muscle aches, especially in the knees, or even heart problems. So if you are taking this medication and you experience anything like that, be quick to talk to your doctor. So today we've learned a lot. We know what antibiotics are, your responsibilities and considerations when you are taking antibiotics, and we've also discussed the side effects that comes with antibiotics. Thank you very much for watching this video and staying with me. Have you learned something? Can you drop it in the comment section? Is there anything I did not really clarify and need further clarification? Drop it in the comment section and I'll answer to that. If you have found this video very useful, why don't you like it, share it, and subscribe to come back for more? Thank you.